Good evening. We begin tonight with our local hospital systems overwhelmed with COVID patients amid crisis standards of care. Health and Welfare has told us there's a good chance that care and resources for patients could be rationed as a result. And that's exactly what happened to one Boise woman after finding out she couldn't get a much needed surgery in her home due to our overcrowded hospitals. She is now in California looking to get the care she desperately needs. Our Andrew Bartline is here. He spoke with her today and joins us with the story. And unfortunately, Andrew, this is something others are certain to be faced with in the near future.
And she says she went to California on advice from her doctor. Both her OB/GYN and on-call doctors at St. Luke's told her there's nothing they can do here to help her locally. But with low COVID rates in the Bay Area, Chelsea's OB/GYN told her she could get the care she needs if she's willing to make the trip.
First, my doctor's office.
Chelsea Titus has been diagnosed with endometriosis and needs a surgery to remove one of her ovaries.
And it's extremely painful, and especially when you have a flare, and I'm having a flare right now.
She needed a CAT scan to confirm the cause of her pain, but local Idaho hospitals have their hands tied amid crisis standards of care.
Last weekend, I was on the phone quite a few times with on-call doctors trying to manage my pain and my nausea, and they just kept saying, you know, if we weren't in crisis standards of care, we would have you come in. But there's nothing that the hospitals will be able to do for you.
Under crisis standards of care, the Idaho Department of Health and Welfare says your ability to receive care in a hospital will likely be affected. Surgeries are being postponed. Emergency departments are full. Because of this reality, Chelsea's doctor directed her toward Palo Alto, California. That's where she is now.
The guy at the hospital who was transporting me for my CT scan was stopping people in the hallway to say, "You'll never believe this. This person had to fly here from Idaho because she couldn't get care in their hospitals."
Chelsea got the CAT scan and is scheduled to get her surgery Wednesday just south of Palo Alto at El Camino Hospital.
And then I think about the people in Idaho that can't come to California. They can't come to wherever to get surgery, and they're just at home suffering. It breaks my heart and makes me so sad, and I feel like it was so avoidable.
The Bay Area has some of the highest vaccination rates in California, and where Chelsea is in Santa Clara County, the county public health department says more than 83% of the eligible population are fully vaccinated.
It was me and one other person the entire time I was at urgent care, because they just are not in crisis here. They're basically having normal life out here, whereas at home, I can't get care that I need.
And that's leaving Chelsea frustrated with what's happening back home in the Gem State.
If Idaho were not in crisis standards of care, I would be at home with my family and I would be recovering right now. And I wouldn't be in massive amounts of pain away from home waiting for a surgery.
We reached out to St. Alphonsus and St. Luke's about what kind of surgeries are being put on hold for now and who might have to wait. We haven't heard back from them today, but we do know crisis standards of care declaration. It says that St. Luke's was unable to treat what's called yellow surgeries. That includes removal of low-risk cancers, fractures, and hernia repairs. Mark?
Another fallout from what we're seeing at our local medical facilities. Andrew, thank you.